pharmacies. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Good morning and welcome to Health Matters at the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us this morning. Before we begin, I'd like to thank our sponsor, Studio Arts and Glass, Mercy Medical Center, and of course, our socially distant technical producer, J.D. DeAngelis. Today, Brad and I are broadcasting from our administrative offices, and our guest is Jim Adams, Health Commissioner for Canton City Public Health. Good morning, Jim, and welcome to the show.
Morning, Paul. Good morning, Brad.
There aren't many topics more widely or hotly debated right now than receiving a COVID-19 vaccination. A poll released last week showed that only 47% of Americans plan on getting the vaccine. Those who didn't want it mostly said they were concerned about the side effects and the development and approval process, though the poll didn't ask about many widely circulating myths. This morning, we're fortunate to share this time and space with Jim Adams to set the record straight and to talk about the facts and myths surrounding the COVID-19 vaccine. We also want to thank Jim and the staff at the Canton City Public Health for vaccinating the staff at our Canton Medicine Center Pharmacy. The process was efficient, professional, and greatly appreciated. Thank you. We'd like to remind our listeners our program is also available on our podcast. You can search your favorite podcast app for Health Matters with the Medicine Center Pharmacy, and you can join listen to our program anytime.
Okay, Jim, thanks for coming on. I know you're very, very busy this time, and welcome to the show again. And tell us about yourself and introduce yourself to our listeners.
Thanks for the opportunity. Well, as you mentioned, my name is Jim Adams, and I've worked for Canton City Health Department, Canton City Public Health since 1985. So this is my long career at the health department, which I'm very, very proud of. I've been the health commissioner for the past 13 years and am glad to lead a very professional staff as you experienced when you got your vaccinations. We do a lot of activities in the community, not just vaccinations, and I'm very, very proud of the staff and the way that they work with the community. I will point out that the Public Health Department is a creature of state law. We are authorized by state law. We're controlled by a Board of Health. Our Board of Health is appointed by the mayor and confirmed by City Council, and then they help us establish health promotion policies within the community. We are one of 4 health departments located in Stark County. So ourselves, we have approximately 70 employees, 2 smaller city health departments, Alliance and Massillon, and then the Stark County Combined Health District takes up the rest of the jurisdictional area of the county.
So how about the basics? How do we know that this vaccine is safe?
Sure. So this vaccine was developed by NIH, National Institutes for Health, and it goes through a full FDA approval process, just like any other drug and just like any other vaccine. So it has gone through, the vaccines that have been approved now have gone through a series of 3 trials. They have had at least 60 days of safety evaluation before the approval was given by FDA to use this vaccine. And it has there has been no compromise in the safety protocols and the evaluation protocols to bring this or any other drug to market. Point out that it's been evaluated by at least 2 independent committees, plus career scientists at FDA, not politicians, but career scientists at FDA have made the decision to release this life-saving, this miracle vaccination into our community under an emergency use authorization, which means that they have evaluated both the safety and the efficacy and balanced that against the need to address the needs of combating the COVID pandemic.
I think it's amazing that they approved this vaccine so quickly. I mean, over the years, vaccine approvals have taken 5-10 years to get them into the marketplace. How did this happen that they did this so quickly?
Mm-hmm. Yeah, a couple things is the federal government made the major investments in the production and the development of the vaccine. So the companies that actually did the manufacturing did not assume the financial risk for this. The federal government did. And so they were able to put a lot of resources into that development process. We have, over the last 10 years or so, have made astounding advances in vaccine technology, particularly in what they call the platforms, or the methods of delivering the vaccine in an efficient way to people to elicit an immune response. And so these developments, new vaccine developments, have allowed us to develop a new vaccine in a quicker manner using these new platforms. The other thing that's allowed it to come to market quite quickly is the vaccine trials were the largest vaccine trials ever conducted. A typical vaccine trial might have 5,000 to 6,000 people involved in the trial. It takes a lot longer time to gather data from a smaller number of people. These vaccine trials range between 30,000 and 40,000 individuals. So they were able to gather a lot of data to evaluate the safety and the efficacy of this vaccine.
How about this emergency use of this vaccine compared to approval by the FDA? Has it not been approved by the FDA?
It has been approved by the FDA. So the FDA has a process in place whereby they will grant emergency use for drugs, devices, and vaccines if they think the benefit of the emergency use outweighs known risks for the device or the drug. So it is approved by the FDA.
Okay, that's good. What about the side effects of this vaccine? Are there any?
There are some side effects. Side effects from any vaccine indicate that your body is eliciting the response that you want to get from the vaccine, which is building up an antibody response for when you are exposed to the actual illness. So typical side effects that we've seen from this vaccine are soreness or redness at the site of the injection, and I think that's a side effect that is with most vaccines. You could experience a headache that might last a day or two, some aches and pains, and those are the main side effects that have been seen with this vaccine.
Interesting. I experienced none with my injection, so maybe a little achy arm, but that's normal, as you say, for a needle. So.
So I participated in the VSafe program. So when you guys handed out the paperwork, one of the things you could do was sign up for the CDC side effects monitoring program. And it's been kind of neat to be part of that, to get a text every day and comment on, take a little survey on what kind of vaccine side effects you may or may not be having. So I thought that was really interesting. If someone is experiencing side effects, what do you suggest that they do, and who do they report those to?
Yeah, the first thing they should do is really talk to their healthcare provider about any side effects. And that conversation with your healthcare provider will help to understand whether you're experiencing a side effect from the vaccination, or you have some other health issue that's going on. If there is a side effect that needs to be reported, like you pointed out, Brad, the CDC does have a text app that will allow you to report any kind of issues that you might have, and that will be evaluated by the safety committees around the vaccine. But they have long had a vaccine safety monitoring program for all drugs and vaccines, and so that gets reported into that system.
Because the vaccine was developed and marketed so quickly, we do have some concerns from customers that I hear that, it's sometimes anything new is just, whoa, I want to wait. But what you've laid out so far, I think, is really interesting. I almost wonder if there's an argument for there might actually be more real data that was studied in a larger population of patients for a vaccine coming to market than other vaccines in the past. Am I stretching, or is
that is absolutely
accurate?
True. That is very accurate. Heard an interesting podcast by Dr. Fauci, who we all recognize now. And he pointed out two facts that I didn't know. One was the size of the studies were exponentially larger than most vaccine trials. And so they were able to gather, huge amounts of data, particularly about the safety of the vaccine. And so the FDA advisory committees feel highly confident that this vaccine is a very safe vaccine. The other part is, and I didn't know this, is that for most vaccines, if you're going to have a serious reaction to the vaccine, that will occur within 30 to 45 days. And so as part of the safety protocols that the FDA has established, they have a mandatory 60-day waiting period from the start of these phase 3 trials to make sure that you're not going to have any obvious serious side effects from the vaccine, and there have been none within that period. So they have evaluated the safety from that aspect too.
Okay, interesting. All right, well, how about we touch on some of the interesting facts and fiction that we've seen on social media or other sites. Let's talk about those that are concerned that there's a microchip in that vaccine and they're going to track you.
Yes, that has been a persistent fallacy from vaccines for many, many years. From giving injections yourself at your medicine center shop, if you can figure out a way to get a microchip through a tiny needle, then you're a much better scientist than we are. And so that is a complete fallacy. There's just no way that can happen.
I would like to think we'd be at like the Dr. Spock zap you and heal you mode if we could do that stuff.
Yes.
But yeah.
Yes, that'd be awesome, wouldn't it?
Yeah, it would be awesome. What about 5G cell phone technologies causing COVID-19?
Well, COVID is caused by a virus. It's a coronavirus. 5G technology is electromagnetic radiation. There is absolutely no connection between the two.
All right. What about face masks don't work?
We do know that face mask works and we know that through both studies from the 1918 flu pandemic, as well as our current experience. And we know that communities that initiated early requirements for face masks and are much more diligent at wearing face masks have lower infection rates in their community. And so we know from both empirical and practical experience that face masks do work at preventing the spread of the virus in the community.
I'm guessing that surgeons wouldn't be wearing face masks when they're operating on you if face masks didn't work either. But
that is correct.
That's usually my analogy. So
yes, infection control has long used that.
What about wearing a face mask can cause the virus?
Again, it is a coronavirus that is spread through the air through small droplet infection. And so a face mask would be impossible for a face mask to actually cause the infection. The infection is caused by a virus.
Okay. And myth number 5 on my list, the vaccine will alter your DNA.
DNA. Okay, this is a vaccination that does not enter any of the DNA part of your system. So it does not alter any DNA whatsoever. It is not a live vaccine. It has no components of a vaccine that was ever alive. It is impossible for it to alter DNA.
Okay. And you're not going to get coronavirus from the vaccine because it's not a live or attenuated vaccine, correct?
That is correct. Yeah. Okay. And you bring up a couple of points. There are vaccines for other diseases. Some are modified live viruses. Some are attenuated viruses. Some contain pieces of live virus that they sliced off and put it onto some type of platform to deliver the vaccine. None of this is true for the coronavirus vaccine. It was never a live virus.
Okay, Jim, time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Can you hear me, Jim?
Paul White from the Medicine Center Pharmacy.
From
1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years.
Paul or Brad, I don't think you have a whole lot after this, right? So I think we're going to be okay with the time.
Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
Mercy Medical Center wants you to know we are here for you literally and virtually. For our patient safety, Mercy is providing virtual doctor appointments from the comfort of your home. This service is available for staff care, urgent care, 7 days a week, and Mercy Primary Care Monday through Friday. See our website at cantonmercy.org/telehealth for office and appointment hours. Mercy telehealth visits are simple, convenient, and can be used by anyone who has access to a smartphone, tablet, or computer. computer. Our Mercy representatives are ready and happy to assist you. So, whether you are in need of urgent care for minor illnesses and injuries or would like a one-on-one with a Mercy primary care physician, Mercy is here for you. Mercy Medical Center telehealth appointments. Learn more at cantonmercy.org/telehealth. That's cantonmercy.org/telehealth. Online appointments are considered medical services and will be billed to your insurance copays and deductibles apply.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by Store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by Store in Louisville, next to the Medicine Center Pharmacy.
Yes, we are open. We are open. The Medicine Center Pharmacies and the Half Off and Out by Store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center Pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are discussing the COVID-19 vaccine with Jim Adams, Health Commissioner with Canton City Public Health.
All right, Jim, I know pharmacies, we were designated in Group 1A to receive the vaccine, and there are school employees and other essential employees designated in Group 1B. What group designates the general public, and when do you foresee availability for them?
Yeah, that's a great question, Brad. You know, as I mentioned before, this vaccine was developed and under the auspices of the federal government. It is then given to states, and the state is the one that decides the best use of the vaccine. And we are obligated as a provider of pandemic vaccine to follow the rules the state sets down. So for Ohio, it is the Ohio Department of Health and the governor's office that are making the recommendations for these various tiers as vaccine rolls out. And as you mentioned, there are, and we all know now, there are several tiers. And as vaccine becomes more available, you'll see an expansion of the number of people that are eligible to be vaccinated. So the challenge for the governor's office is that he wants to make these first few doses of vaccine that are available in the community provided to the people that it's going to provide the best benefit to. And so their decision for that is to roll it out to older adults first. After we've completed these tier 1 healthcare workers and things, roll it out to older adults first. Very important to keep kids in school. And so they've made a determination that it is important to vaccinate staff of school that are providing education to our children. And then we'll move on from there as vaccine becomes more and more available in the community.
Okay. Go ahead with your next question.
Hey, Jim, should children be vaccinated?
Yeah, so the vaccine right now is only licensed for people that are 16 and older for the Pfizer vaccine and 18 and older for the Moderna vaccine. So children are not eligible right now under the authorization for vaccination.
What if I've already had COVID-19? Should I still get a vaccine?
Yes, you should. We know that infection with COVID-19 might confer some immunity for a period of time. It is highly variable based upon your symptomology and how ill you were with COVID at the time. Vaccination is going to provide the most durable and the most reliable immunity long term.
So how long after we were cured, I guess, that's not the right way to put it, but recovered, yes. Uh-huh.
Yeah. I think the recommendations are something like 14 days. I don't think they want you to be vaccinated while you have active illness, but I think I saw something around 14 days. That's a discussion to have with your healthcare provider, of course, if you're ill.
What about this variant that's kind of COVID-19 run around?
Yeah.
Vaccine help against that?
The information that I've seen indicates that the way the vaccine was designed, it's designed to address what's called a spike protein on the coronavirus, which tends not to change very much and modify very much. So it is expected that this vaccine is still effective against some of these modifications, some of these variations that we're seeing. To also point out that coronaviruses mutate very frequently.
Yeah, sure.
Throughout a season, they'll change quite a bit.
So how long is the protection from the vaccine?
Yeah, so we don't know. Our early indications are that it elicits a very durable response, and it might be a year or more or several years. But of course, that information will become more available as more and more people become vaccinated, and they evaluate that over time.
Difficult to predict. Would that be right to say that?
It is, but there are some current studies out that are they're not peer reviewed yet, but there's some very promising data that shows that it elicits a very strong immune response, and that it could be quite durable.
Okay.
So the vaccine requires 2 doses. Can you address the effectiveness after the first dose and what to expect when the second dose is due?
Sure. So both vaccines that are currently approved in the United States require a 2-dose regimen: a priming dose, a first dose that gets your body ready to develop the antibodies that are then ramped up on that second booster dose. So all the evaluations and protocols for these 2 vaccines used a 2-dose regimen, and so that is what is recommended. There is some immune response after the first dose for both vaccines. They vary by the type of vaccine, but for the best protection, you're going to need a booster shot for these 2 vaccines that are initially approved.
Who's paying for the vaccine?
Federal government. So this vaccine should be available to anybody in the United States at no cost.
All right, Jim, we're running close on time here. Can you give your contact information at the health department and how people can get in touch if they have questions beyond our discussion today?
Yeah, I mean, the best way is to look it up on our website. We try to update that on a regular basis, and that's cantonhealth.org. We also have a phone number for our nursing division is 330-438-3322. But I encourage people to look at the website first for their best response.
Well, Jim, we thank you very much for taking time out of your busy schedule to join us this morning. And it's been very informative. And thank you for all your hard work that you and your team are doing.
It's my pleasure. It's glad to be of service.
Thank you very much, Jim. We appreciate it.
You're welcome.
Learned a lot. Okay.
Good.
Okay, bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
All right. So you guys good?
Yep. Thank you.
All right.
Great. Thanks very much.
It's my pleasure. Yeah.
Thank you very much.
Glad to help, and I hope it helps other people too. So.
For sure.
All right.
Trump administration
Be well.
cabinet members
Have
are
a good day.
resigning after the
Bye now.
attack on the Capitol on Wednesday. Transportation Secretary Elaine Chao and Education Secretary Betsy DeVos are the latest to say they're leaving their jobs in protest. The rioters who stormed the U.S. Capitol on Wednesday could each face up to 10 years in prison for destroying federal property. That's according to...
And, you know, you don't have to wait in the vaccine to save you from the evils of the COVID world or flu and cold. You can support your immune system on a daily basis. And there's some really simple, basic things you can do that have some really good science behind them to do that. One thing is a simple multivitamin. Even the most basic of multivitamins have been shown to reduce the risk of common cold by almost 20%. And there are essential nutrients in those multivitamins that you may not get in your everyday diet. You know, a tomato grown today isn't the same as a tomato grown 30 years ago because there just aren't as many nutrients in the soil. And there's certain things that farmers don't put back in the soil. They put nitrogen and phosphorus and some other things like that, but they don't put minerals back in the soil like magnesium and zinc and copper. So there are things where if areas are over farmed, a tomato is not going to have the vitamins in it that it used to. So a basic multivitamin is critical. And one of our favorite multivitamins at the pharmacy is Dr. Linus Pauling Super Multivitamins, which kind of leads me into the next thing. Dr. Linus Pauling did enormous amounts of research on vitamin C, and vitamin C has been proven to decrease the frequency and length of the common cold, as well as incidence of pneumonia. And actually, there's some recent studies that have been done that show that it can reduce the duration of mechanical ventilation by 18.2%. So vitamin C has a role in being proactive for coronavirus treatment and just immune system support. In addition, zinc. Zinc has been found to be very helpful for a number of things. It's actually shown to have benefit for development and maintenance of immune function. It actually has antioxidant and anti-inflammatory properties. And I think one of the reasons it's shown to be beneficial in coronavirus is because of its benefits in inflammation and in anti-inflammatory processes. Zinc has a lot of other benefits too. If you're a patient with diabetes, zinc is very important for insulin use in your body, and how the cells respond to that insulin in your body. So there's a lot of different nutrients that we kind of take for granted, in my opinion. Um, Another big one's vitamin D. Vitamin D generally is a vitamin that when you have a chronic health condition, whether it be heart disease, whether it be coronavirus, whether it be any type of long-term condition, fibromyalgia, it could be Crohn's disease. All these underlying conditions generally have patients that test with a lower vitamin D level than optimal. And vitamin D is very important for modulating the immune system. It's important for helping with that anti-inflammatory levels of cytokines. Cytokines are fancy chemicals in our body that when you get an infection like coronavirus, your body responds to that infection by releasing its little army of tools to fight that infection. And a lot of times that response is inflammation. And your body has the ability to modulate that inflammation, and cytokines can be kind of held at bay if your vitamin D levels are high enough, and that would help your body fight off COVID-19 in advance, but also prevent you being overwhelmed and resulting in maybe being put in the hospital and having breathing difficulties because you're having such pressure on your lungs and requiring ventilation. So simple nutrients, a multivitamin, vitamin C, zinc, vitamin D, all these things are just basic things that whether you're trying to be proactive to prevent coronavirus or the common cold and flu, or you're getting ready to get the vaccine, you could benefit from those every day starting today. So stop in our medicine center pharmacies and talk to one of our pharmacists, and we'd be happy to help you choose the items and work with the dose to get you on the right track.
So as a pharmacist, what vitamins are you taking?
I take a bunch of stuff, and I try to take it based on some of the things that I'm dealing with. So, I take a multivitamin. I'm taking the vitamin D, I'm taking zinc daily, I'm taking C daily. I take a fish oil daily. We have a great product called Brain Armor, which is an EPA DHA combination to help support a healthy heart and skin and nails. I also take something for cholesterol. I take a statin drug. So I think taking coenzyme Q10 is very important to balance that out. One of the things we've been actively educating our patients on at the Medicine Center is what we call nutrient depletions. And it's very common when you take a medication that sometimes you have a nutrient depletion of something else. So if you take a statin medication like Lipitor, Zocor, Crestor, your body is automatically at risk of being low in coenzyme Q10. And coenzyme Q10 is a very important nutrient for heart health and the basis of what the energy molecule is in your heart for pumping. So if you have leg cramps or you feel tired all the time and you're taking a statin, you can really benefit from taking coenzyme Q10. It's also another benefit is I take a B complex vitamin. I am not a very good methylator by a genetic test I took. So if you take any type of B complex vitamin, it can not only boost your energy levels, but it can also help you with other important metabolic processes in your body.
Interesting. I've read that it has been discovered that many people who become the sickest from COVID are deficient in certain vitamin supplements. You probably just named all of those, but what are the crucial ones that you really need to not leave out of your regimen?
In the last probably 5 or 6 years, as a pharmacist, we've seen an explosion in healthcare providers prescribing vitamin D for patients. There's a really good way to get vitamin D levels tested. We actually offer that test. You can walk in and get that test at the medicine center pharmacies, and you can find out what your vitamin D levels are. But it's interesting to see in regards to the status of a patient's health and immune response, and then look at their vitamin D level. So it's the patients that get more respiratory infections, get more common colds, get pneumonia more often. They all generally have lower vitamin D. So vitamin D is extremely important, and we're learning more and more about that all the time. It's almost becoming a secret weapon to prepare your body's immune system for what's to come.
Okay. So what do we prepare for in our home for the bad virus running around? Do we keep cough cold? Do we keep pain relievers? Over-the-counter type products? What do we keep? We know we can't run out to the drugstore when we get sick. So,
and I feel like it always happens at 10, 11,
yeah,
12 o'clock at night.
Yep.
You go to your medicine cabinet and you're like, where's my thermometer? Oh, I don't have a thermometer. I feel feverish. I think there's just some basics you always ought to have. And, with sending a kid off to college, we've been kind of thinking about these things too. So I think it's best at minimum you have a thermometer, you have some pain medications and some fever medications. Excuse me. Tylenol is important and a staple in any medicine cabinet. Motrin is a good staple to have for bumps and bruises. Antihistamines and decongestants. So, whether you go for a non-sedating antihistamine like a Claritin or an Allegra, or you have some Benadryl around in case you're worried about getting a bee sting or some allergic reaction, those are all important. It's also important to think about some decongestants. Things like Sudafed or Mucinex D can help with sinus congestion and sinus pressure. All those things are common with the common cold. I feel like given that this season, everyone's really been proactive about washing their hands and wearing their masks and limiting their contact with other patients and people, I feel like we've had a lot of benefit with controlling the flu this year and controlling the common cold. And I think it's a testament to show you that if you're more proactive in cleaning your surfaces and washing your hands, you can really make a big impact on that. But it doesn't mean that you're not going to need those staples in your medicine cabinet. Probably also a really good idea to have an anti-diarrheal, like an Imodium or something, in case you have a little problem. And don't overlook having some fluids. A bottle of Gatorade or a bottle of Pedialyte isn't a bad thing to have if you have a stretch of vomiting or nausea or dehydration, because something like that can help you rehydrate and get those electrolytes back could actually help you stay out of the hospital if you have a bout of vomiting that is extended. So, what I missed? Did I miss anything?
Green tea. The old professor at Ohio Northern was always suggesting green tea for cough, cold, and all that sort of thing. I don't have any idea as to whether that really fits this pattern, but you really need to drink plenty of water. I mean, and Coca-Cola and caffeine drinks and all that sort of thing. I'm not sure where they fit in the picture either, but everybody loves coffee. Everybody loves tea, iced tea, whatever. The fluids at least give you liquid. So many people say, well, I can't drink water. Well, you can drink water, and you need to drink a lot of water during this thing that's going on. So, and I also think it's time for the last break. Is that right?
Yeah, we can take a break.
You are listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out by store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out by store in Louisville, next to the Medicine Center Pharmacy. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Yes, we are open. We are open. The Medicine Center pharmacies and the Half Off and Out by store in Louisville are open. Some great services are still in play. Our drive-through windows, curb service, and our enhanced delivery service. Our stores are fully inventoried and fully staffed for your convenience. 13 pharmacists to help you with your medications and over-the-counter products. So don't hesitate to visit us or use one of our services. Medicine Center Pharmacies in Canton, Louisville, New Philadelphia, and Minerva.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. We're in our final part of the show, so let's get back to it. So, Brad, for 20 years now, we've been offering free local delivery, and you know, it's a great service to many people who can't get out very often or can't even get out. So, what's the best option to get your medication and supplies you need? We have drive-through windows, we have curb service, you know, you can walk in our stores. What else are we doing to keep our patients and customers safe?
You know, I guess I think it's worth noting that in this environment in the last year where everybody delivers now with, you know, the big names, the Grubhubs and the DoorDashes and all, we have our own staff members on staff, our own vehicles. Your medication and your orders are all in our own control. They're never outsourced to some third party that you hope is going to pick it up and deliver it to you on time. So what we like to do is we like to have a very efficient schedule to help our patients so they know when the delivery driver is coming. So we like to use a service that we call medication synchronization. And what we can do is we can have one of our staff members call a patient on any given day during the month. They can go over all your medications, find out if you've been to the doctor, find out if you have something you need from over the counter. Maybe you need some Tylenol or that thermometer we talked about before the break. We can organize it all into a delivery and deliver it on the day that you need it. We can even package your medication into nice little easy dose packs. And it's something that, if you have trouble remember when to take your medication and you take a bunch of medications, we can stick them all in a packet for 8 a.m. in the morning and 12 noon and 6 p.m. And then you don't have to remember if you took them out of all these different bottles. So while those are things that are standard services we've always offered, I think it's been more important now as people are being more mindful of the trips they make out of their home. We certainly can make an efficient delivery once a month to your house with everything you need, from your prescriptions to your over-the-counter items. Even if you need, Band-Aids and diabetes supplies and things of that nature. So it's something that, you can schedule inquiry about our delivery services on our website. There's a nice section there that you can sign up for delivery. You can sign up to get a health coach for medication synchronization. We have a mobile app too, so you can look for our Medicine Center Pharmacy app in the Apple App Store or the Google Play Store, and that's something that you can look at all your refills you have on file. You can order them up from there. You can double check your directions. It even has pill images on it, so you can see if you forget which of your tablets is your blood pressure. You can look at that image and you can see, oh, okay, it's the little pink one with the 2 on it. So there's a number of different things. We even have the ability, if you're interested, on our website to schedule to talk to a pharmacist. So if you can't come in or you want more than just a phone call and you want a face-to-face, you can schedule a time to meet with one of our pharmacists on our website. So we try to have some different options available for you as this is all evolved. And I hope, if nothing else, that our personal touch can help give you some comfort that we want to be there to help you take care of your medications in a safe manner.
So, Brad, we do offer other vaccines in our stores too. What other vaccines do we offer?
Most commonly, flu and pneumonia and Shingrix for shingles have been staples for years. Recently, we've done a lot more Tdap booster shots. Generally, new grandparents, providers recommend that they get a pertussis booster so that they don't have the risk of passing on whooping cough to new babies and newborns. So that's been very popular. Occasionally we'll do hepatitis A, hepatitis B, sometimes varicella vaccines. I guess what I would encourage you is if you're in need for a vaccine or you've missed a vaccine because maybe your regular provider has canceled an appointment, give us a call at the Medicine Center and we can see what we can work out with you. Between our 4 locations, we have a lot of different supplies in stock. And if not, it's generally something that we can try to work with you and your insurance provider to see if we can help you with. So we've done meningitis, number of different things.
So what else do we need to add to the show today, Brad?
Well, I think if nothing else, regardless, I would encourage you, as someone who has had the COVID-19 vaccine and had no problems so far, I would encourage you to seriously think about it. I think we all agree that we want 2021 to be a heck of a lot different than 2020 was. I'm anxious to try to squeak in a vacation and go to a nice destination, or at least go out to dinner with my wife and not have to worry about it. I think it's important that you prepare your immune system today. You need to start today, if you're not already, and get your vitamin D, get a good multivitamin, get a good zinc, and look at your medication profile. Talk to one of our pharmacists at the pharmacy. We would be happy to go over with you. If you're a female and you take a birth control pill, guess what? You have a nutrient depletion of B complex vitamins. So you need to take a B complex every day. If you're taking diabetes medications like metformin, you need to take a B complex vitamin every day. So let's not start from several squares back from square one in your body's support of nutrition. Let's start at a good baseline and move forward so that you can not only set yourself an advantage to prevent getting COVID-19 or the cold or the flu, but let's try to practice some optimum health practices. And the pharmacist at the Medicine Center would be more than happy to help work with you to do that. I think it's also worth mentioning that in 2021, we are also now a preferred vendor for Medicare Part D for Primetime Health Plan. So if you're a Primetime Health Plan member, we'd be happy to welcome you to the Medicine Center Pharmacy to help you with your medication needs. We offer the compliance packaging, we offer home delivery, and we've been a staple in the community for over 40 years. So we'd love to help you and be part of your healthcare team.
There's no extra charge for packaging, correctly?
There is no
correct?
extra charge for packaging. It's something that the only charge is a little bit of time. We have to work with you and your provider to make sure we got all your prescriptions lined up. But then that way you don't have to worry about being out of that one medication. It can be all lined up together, and we can make sure that everything's tied up for you real nice and neat and efficient.
I think we have, about a minute left? That be correct?
We got a minute left.
Okay. We want to thank our special guest today, Jim Adams, Health Commissioner for Canton City Public Health. It was very interesting, and we learned a lot, and I hope you did too. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course, our technical producer, J.D. DeAngelis. As always, we thank you, listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. Stay healthy. Stay distant. And we'll see you again next Friday right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health